Well, now that we've established the prevalence and importance of OAB in men, let's talk about a treatment that may help improve OAB symptoms in men being treated for BPH. The Phase 3 EMPOWER trial that led to the initial indication for Gemtesa enrolled primarily female patients, and therefore there was not a lot of data on male patient responses to Gemtesa. Dr. Staskin is going to explain a recent study that examined the impact of Gemtesa in men with OAB and were being treated for BPH. Dr. Staskin will start by giving us an overview of the COURAGE Phase 3 trial that led to this indication for Gemtesa.
And the name of the trial was COURAGE, and it was a Phase 3 randomized controlled trial that assessed the efficacy and safety of Gemtesa in men with OAB receiving pharmacologic treatment for BPH. Following a 2-week placebo run-in period, patients were randomized 1-to-1 to receive 75 milligrams of Gemtesa or a placebo for 24 weeks. The baseline demographics were well balanced across the treatment groups. The mean age was 67 years, and over half had pre-existing hypertension. For study entry, patients had to have symptoms of OAB for at least 2 months, with an average of 8 or more micturitions per day and at least 3 urgency episodes per day. Patients also had to be on pharmacologic treatment for their BPH symptoms. The patients were excluded if they had a 24-hour urine volume greater than 3,000 mLs, nocturnal polyuria, defined as greater than 1/3 of the total 24-hour urine output occurring at night, if they had a maximum flow rate less than 5 mLs, or a history of urinary retention or any urinary tract pathology other than BPH that could explain symptoms of urgency, frequency, or incontinence. Efficacy endpoints which reflected the key symptoms of OAB, including UUI, urgency, and frequency, were co-primary endpoints of the change from baseline, or CFB, and average daily number of micturitions and urgency episodes at week 12. Key secondary endpoints include change from baseline to week 12 in mean daily UUI episodes and volume voided per micturition.
Before Dr. Staskin summarizes the results, I'd like to discuss some of the important safety information related to Gemtesa. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for the signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking those muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Now, angioedema of the face or the larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling and may be life-threatening. If involvement of the tongue, the hypopharynx, or the larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Dr. Staskin, can you summarize the findings from the main primary and secondary endpoints from your trial?
Certainly. At week 12, Gemtesa was associated with a significant reduction versus placebo in mean daily micturitions and in urgency episodes. And this persisted from week 12 to week 24. At 12 weeks, patients taking Gemtesa saw a significant reduction in mean number of UUI episodes.
Before Dr. Staskin talks to you about the safety data from COURAGE, I'd like to briefly summarize the safety signals observed in EMPOWER. The most common adverse reactions reported from Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. To learn more, please refer to the full prescribing information for Gemtesa following the presentation. Dr. Staskin, Can you talk to us a little bit about what was observed in the safety data?
Certainly. Overall, 45% of patients taking Gemtesa and 39% of patients taking placebo experienced one or more treatment emergent adverse events, or TEAEs. The only adverse events exceeding placebo rate and occurring in 2% or more of patients receiving Gemtesa or placebo were hypertension and UTI. Serious adverse events, or AEs, occurred in 4.3% and 2.9% of patients receiving Gemtesa and placebo, respectively. No serious AEs were considered to be treatment-related by any of the investigators. Treatment emergent adverse events leading to study discontinuation occurred in 2.9% of participants who received Gemtesa and 2.7% who received placebo.
Thank you, Dr. Snaskin. Results from the COURAGE trial were generally very consistent with EMPOWER, highlighting the efficacy and a positive safety profile in both men and women with symptoms of OAB. With this indication, Gemtesa is now the first and only treatment approved for OAB in men treated for BPH.
However, please note the following. Digoxin drug interaction was identified with Gemtesa. Measure serum digoxin concentrations before initiating Gemtesa. Monitor serum digoxin concentrations to titrate digoxin dose to the desired clinical effect. Continue monitoring digoxin concentrations upon discontinuation of Gemtesa and adjust digoxin doses as needed. Thank you.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.